We are here to talk about mothers, pregnant mothers in Mandera County. A situation of severe anemia among pregnant women that is related to drought-induced malnutrition. A silent but dangerous situation of severe anemia among pregnant and lactating women is unfolding in Mandera County. Data from health facilities is painting a gloomy picture of moderate to severe anemia, especially of pregnant women who present to health facilities for delivery. The current prolonged drought, which is the worst in 40 years, has adversely affected the pastoral community livelihoods. Moderate to severe malnutrition with consequent anemia related to drought is now a cause of detrimental maternal outcomes during labor. This is compounded by poor antenatal clinic attendance among pastoral communities who tend to migrate from one point to another with their livestock in search of pasture. The situation has also not spared the urban poor, and presenting with anemia, severe anemia in labor compounds the possibility of bleeding after delivery, what we call postpartum hemorrhage. The risk becomes exponentially higher when mothers require operative delivery. Mothers with moderate to severe anemia in Mandera County and who are presenting to labor or during delivery or in labor are at a greater risk of dying from postpartum hemorrhage. And therefore, the axis of severe current drought, maternal malnutrition, severe anemia, and PPH is now what is emerging as a threat to life. I want to give a disaggregated data of malnutrition and anemia among mothers presenting for delivery. The trend towards malnutrition among pregnant mothers has been increasing from June this year. In June this year, 921 pregnant mothers were treated for malnutrition in Mandera County in various hospitals. In July, it was 923. In August, it is 1,037. In September, it is 2,479. In October, it is 2,204. This therefore shows an increased trend in the number of mothers, pregnant and lactating mothers, presenting with moderate to severe malnutrition. In terms of anemia, in Mandera West Sub-County, we had, just for this October, last October, we've had 4 mothers presenting with severe anemia in pregnancy coming for delivery. In Mandera East and largely Mandera County Referral Hospital, we have had 34 mothers with moderate to severe anemia coming for delivery. In Kutulo, the number is 52. In Mandera North, the number is 12. In Banisal Sub-County, the number is 50. In Mandera South, the number is 6. In Lafe, the number is 80. When you add up these cases in terms of the numbers, it comes to about 202. I want to give 3 cases of mothers who have presented in detrimental situation of severe anemia and presenting for delivery, just to highlight the situation as it is. Case number 1. Mrs. S is a 19-year-old female at 32 weeks gestation from the bordering town of Sade in Ethiopia. This is in Mandera North. She has attended 2 antenatal clinics on the Kenyan side, was put on IFAS from the first ANC. At the second antenatal clinic, she was noted to have a HB of 3, and she was referred to Ramu Sub-County Hospital for emergency transfusion. The source of livelihood is pastoralism, and the husband is a poor person. The family had no relatives in Ramu, and because of severe anemia of 3, HB of 3, it necessitated a situation where health personnel at Ramu Sub-County Hospital had to donate blood. So 3 of the healthcare workers had to donate 1 unit each to save this mother. Case number 2, Mrs. H is gravid with her 8th child. She is a pastoralist, and the husband is also married to a second wife. She came with severe anemia, delivered at the facility, and was found. After delivery, she also presented with postpartum hemorrhage and was subsequently referred from the primary health facility to Ramu Sub-County Hospital. At presentation, she had a HB of 4 grams per deciliter, which is a threat to life. She was stabilized and transfused 3 units of blood. Nutritional support was given, and she is currently out of danger. Case number 3, Mrs. G is a 27-year-old pregnant mother expecting her 5th child. She is a pastoralist and has never attended any antenatal clinic due to the drought situation and her constant movement from one area to another to ensure her hard survival. She developed eclamptic convulsions, and therefore she also had severe PET. She developed convulsions, was referred to Mandera County Referral Hospital by the county ambulance in an unconscious state and in respiratory distress. At MCRH, assessment by a team of multi-speciality was done. The mother was noted to be in critical condition. She had twin gestation, that is, she was carrying twins. She had moderate anemia, low platelets, very high blood pressure of 186/116, and was fitting and was not in labor. So here is a mother at a term with twin gestation, never attended any antenatal clinic, presenting with severe anemia, eclampsia, on top of every other thing. And therefore emergency intervention and stabilization was done. Blood works, including grouping and cross-matching, done. She was safely operated by a team of doctors. 2 live twins were extracted, are in fair general condition, and the mother was life support. Today is her 3rd postoperative day, and she is responding well to care, although she still remains critically ill. From the foregoing, it is now very clear that the situation of drought with resultant malnutrition is now posing a great danger to maternal life during delivery. As a ministry, we want to urge on a few things. Number 1, we want all fathers, men whose wives are pregnant, fathers and brothers whose sisters are expectant, to take responsibility and get involved in antenatal care visits by pregnant mothers, so that then any complication or any problem that arises is known and solved at that point in time, well before delivery. 2, all pregnant mothers are encouraged not to skip any antenatal clinic visit, so that then again, a second time, problems are identified early enough. Finally, partner support is more urgently required now than ever for pregnant women in Mandera County. We call for emergency support for pregnant women and lactating mothers on top of the children that we have highlighted previously, in terms of availing supplementary feeds at all antenatal visits for pregnant mothers. These supplementary feeds include CSB, which is a special porridge, Mama Light, Lipto Mama, and others that are available. The health staff will keep on supplementing IFAS, but IFAS will not supplement, will not replace the health staff will keep on supplementing necessary IFAS food that a mother requires. Will not supplement. Thank you very much. Will not replace.
Alaikum. My name is Dr. Abdi Maalim, the County Director of Health Service, and a consultant obstetrician and gynecology working with Mandera County Government. I just want to give a brief background of pregnant mothers in the county and the importance of antenatal care to the mothers to avert some of the complications already alluded by the CC Health. Antenatal care is a care provided by skilled health professionals to pregnant women and adolescent girls to get the best health condition for both the mother and the baby. This antenatal care is very important because this is the time we are going to do what is called risk assessment for both the mother and the fetal. We do the screening for underlying conditions like hypertension, diabetic, HIV. We also do the fetal assessment by early ultrasound before 24 weeks. These visits are important because we do some preventive measures where we give tetanus toxoid to the mothers and the women. Nutritional interventions are being carried out to these pregnant mothers owing to the prevailing drought situation in the county. The nutritional health education is given, and mothers are normally encouraged to attend this antenatal clinic to avert future problems during the course of their pregnancies. Various underlying investigations is done, both blood workup and other tests, to detect early conditions that normally present themselves during pregnancy. There are 4 antenatal visits currently in place, although some counties have adopted the 8-visit contact, and we encourage our mothers. They start their, antenatal clinic before 12 weeks gestation. This will help us to detect early conditions that cannot be prevented at later stage. Having given that background, I need to talk about one of the common conditions that we see with mothers in Mandera. That is anemia. Anemia is a low hemoglobin level, less than 11 grams per deciliter, and its magnitude is very high in this county, as explained earlier. This also is happening across the developing countries, with about 56% of these pregnant mothers having anemia. They are classified in terms of their severity or in terms of either whether they are physiological. There are those anemias which are common to those mothers who are pregnant. And this is majorly because of hemodilution, combination of effect of hemodilution and negative ion balances. That is the anemia that occurs in pregnancy due to physiological changes of pregnancy. There are those anemias that mothers normally get when they are pregnant. These are called pathological anemias. This is normally in our setup, nutritional deficiencies are the most common, the iron and the folic. The others are those due to increased RBC destructions, like acquired hemolytic anemias, which include parasitic infections like malaria or dengue fever. But above all, the most common cause of anemia in our setting is anemia due to blood loss. This can be acute blood loss, which occurs during early pregnancy, what is being called antepartum hemorrhage, APH. Other underlying causes, other cause of bleeding includes the chronic, blood loss. This can be due to infections, which include hookworms or GI bleeding, gastrointestinal bleeding. Who are these mothers who are at risk of getting these anemias in our setting? As we are all aware, most of our mothers give birth to many. It is called too soon, too many. This causes the depletion of iron storage in mother's body. They are called multiparous women. They are married early. The adolescence is one of the risk group of these anemias in our setting. Multiple pregnancies, twins, triplets is one of the issues that cause anemia. The other issue is parasitic infection, the way I've said, like malaria. There are complications that occur as a result of anemia if not corrected early. This complication can affect the mother, the baby, at any stage. Complications that occurs during pregnancy include preterm labor, recurrent infection, preeclampsia, and that happens during labor. We can have postpartum hemorrhage, bleeding after delivery, which can lead to shock and death of the mother. During puerperium, they can also get puerperal sepsis, DVT, and failed lactations. The fetal complication that follows this anemia, you can get intrauterine growth retardation, or you can get death, intrauterine fetal death, or you may end up getting a low birth weight babies. Treatment of these conditions depend on what time did the mother presented to the facility and what is the level of HB that the mother presented with. From our own observations, we found mothers who come late arrival for treatment is common with severe anemias. That we encourage early antenatal care or visits to our mothers. We can prevent these anemias that are causing all these problems by undertaking the following interventions. We need to do preconceptional counseling to adolescents and young mothers. We need to encourage our mothers to do early ANC clinic. They start early before 12 weeks. They need to be given nutritional education and family planning method, because we need to space the pregnancy so that they don't deplete their iron stores. The second condition I want to talk, which is common in this setup, is hypertensive disease of pregnancy. This is an elevation of blood pressure that occurs during pregnancy to a mother. Starts from the diastolic pressure of 140, systolic pressure of 140, and the diastolic pressure of more than 90. They are normally classified into mild, moderate, and severe. However, for our own case, because it's hypertension related to pregnancy, we'll talk of preeclampsia, eclampsia, chronic hypertension, preeclampsia superimposed upon chronic hypertension, or gestational hypertension, which is also called transient hypertension. Some of these hypertensions is as a result of underlying conditions. However, the gestational one is a transient; it only occurs during pregnancy. But mothers who have hypertension before, because of the pressure of the pregnancy, they can get this hypertension disease in pregnancy. And it normally occurs after 20 weeks of gestation. That is 5 months. The other parameters, both laboratory and other tests that can be done to confirm these, hypertensive disorders. The most common and can be diagnosed by even, the common Mananchi is that there's what is called eclampsia. These are hypertensive disorders which present with, seizures. We encourage our mothers to seek medical help when they see a pregnant mother who has presented with seizures. Who are these mothers who are at risk of getting these hypertensive disorders? We need to tell our public, being young, age less than 18 years, which is very common in our setting, or age more than 35 years, getting the first child is a predisposing factor to these hypertensive disorders. The second thing is there is a family history of first degree, primary, family history, where the close relatives have hypertensive disorders. There's tendency that the mother can end up getting hypertension. Or the mother herself had previous pregnancies and she had developed hypertension. She needs to be followed up. Just don't wait for the other pregnancy to occur. Medical conditions like diabetic, renal diseases, obesity, hypertension, these are some of the medical comorbidities that underlie to predispose these mothers to hypertensive disorders. Fetal risk factors include multiple gestation and other things like socioeconomic status. As we are here, this county has, the socioeconomic status is low, the dietary intake is poor. This is also one of the predisposing factors to this, hypertension. Finally, I just want to encourage our mothers to present themselves to the facilities. Once they come to antenatal clinics, these problems can be identified early and corrective measures can be substituted. There are those complications that these mothers get if they are not coming to the facilities early. The maternal complications and fetal complications. The maternal complication will include, which is very common, and that has occurred recently to some of the mothers whom we operated on here, is DIC. DIC is disseminated intravascular coagulopathy, where a mother blood does not clot, and you transfuse and she starts bleeding because of the bleeding disorders. You can end up getting, blindness. She can end up getting blindness or cerebrovascular accident. The fetal complication that occurs as a result of this hypertension is low birth weight, intrauterine growth retardation, or the mother can end up with abruptio placenta, or even the demise of the baby. How do you prevent these, hypertensive disorders of pregnancy? We need to educate our mothers and the community to start their antenatal clinic early as 12 weeks. We need these checkups being done in our facilities, and we need to give some supplement within our facilities which are free, like a low dose of aspirin and calcium supplement to these pregnant mothers who have tendency of developing these hypertensive disorders. In summary, I will encourage to avoid these challenges, to have safe maternal outcome for our mothers. They need to start early commencement of antenatal clinic. Hence, mothers are advised to attend all scheduled visits. There are 4 currently. We are likely to step up with the 2016 WHO model, which is 8 contact visits. Kindly we advise our mothers to attend all the visits as advised. They can be referred to high risk early to make the necessary intervention. Thank you.
Good afternoon. My name is Dr. Abdullahi Mohamed Badei. I'm the Deputy Director, Medical Service. I want to make a rejoinder by comments that are made by my CEC and the Director. I'll be very brief. I'll rush through the causes of maternal mortality. Largely, the causes of maternal mortality are divided into around 4. The elephant in the house in terms of maternal mortality is hemorrhage, which takes around 75% of maternal deaths, and then followed closely by infection, hypertensive disease of pregnancy, and pregnancy losses early in pregnancy. According to WHO, maternal mortality are around 295,000 in a survey that was done there in 2017. Majority of those deaths are in Africa and South Asia. In Kenya, our maternal mortality ratio is around 355. Mandera had a worse maternal mortality ratio of around 3,795. However, we have made huge stride since devolution. We have managed to reduce these maternal mortalities to 389 as per 100,000 live births. And this is a huge strand. So quickly, I want to rush through the major cause of maternal mortality, that is hemorrhage. As of January and October this year, we've had 200 mothers who've had severe hemorrhage related to pregnancies, both before delivery and after delivery. This is as compared to normal deliveries that we have had of around 3,000 deliveries during this period. This bleeding usually is divided into 2 categories: bleeding that occurs before 7 months and bleeding that occurs after 7 months of conception. Usually, bleeding that occurs before 7 months are regarded as abortions, and those that occur after 7 months are regarded as antepartum hemorrhages or postpartum hemorrhages after delivery. So for those that occur before 7 months and are regarded as abortions, usually the risk to the mother is bleeding, and this can be mitigated by mother seeking help regardless of whether she can access dispensaries, health centers, hospitals, or county referral hospitals. All services to mitigate pregnancy losses at whatever level of healthcare is provided. One of the major services that are provided by healthcare professionals is what doctors call MVA, manual vacuum aspiration. That is when there is heavy bleeding, you quickly mitigate and evacuate the product of conception so that you avert severe blood loss, among other cares that is provided. Post-abortal care is one major care that's also provided to avoid maternal infection following pregnancy loss, early pregnancy loss. For those bleeding that occurs after 7 months, which doctors call antepartum hemorrhage, is largely classified into two, and this classification is related to the placenta. Either the placenta detaches before delivery, what doctors call abruptio placenta, or the placenta is implanted low at the level of the opening of the cervix. So this will also cause bleeding. Doctors encourage, because some of these conditions, especially low implanting placentas, are diagnosed much early when the mother makes proper visitation to the antenatal care. If this early diagnosis is made, it will mitigate the risk of delivery or waiting for labor to occur, which will exacerbate bleeding. Quickly, the way a non-medical person can identify placenta previa is bleeding in a mother past 7 months of pregnancy that occurs without any significant abdominal pain. So if a woman is bleeding and there is no heavy or significant pain, then she will quickly think that probably the placenta is low placed and seek health care. For a mother who develops vaginal bleeding associated with pain, abdominal pain, there is risk, especially probably if there is a fall or trauma, or she is involved in an RTA or a motorcycle accident, or she has accidentally slipped and she develops vaginal bleeding and gets abdominal pain, she will need to know probably that the placenta has detached and seek medical attention. One other thing that can cause heavy bleeding is after delivery. And once a woman delivers, usually the doctors say there's a golden hour. And in this golden hour is when mother can be saved. Or it is in this hour that a woman can deteriorate and probably die. So the major causes of bleeding after delivery is when the uterus fails to contract adequately to stop bleeding. The other one is if the placental tissue is retained after delivery, or some heavy clots are retained after delivery. The other major cause is when there is tear of tissues. If she has a cervical tear or tear in the birth canal, all this can also cause bleeding. If the woman has clotting disorders and she probably has low platelets or her clotting factors, this will also lead to bleeding. So generally, the doctors say there are 4 T's that cause postpartum hemorrhages. If the uterus fail contract, if there are tissues that are torn, or probably cervix or the birth canal, if there is a retention of the placenta, or there is clot that is retained in there, or the clotting factors have an issue, either platelets are low or the clotting factors are low. So in summary, the women who are predisposed to bleeding after delivery are women who are originally antenatally anemic, the women who have got multiple pregnancies, meaning she has got twin pregnancies, a woman who has had something what doctors call polyhydramnios, meaning the fluid that surrounds baby during pregnancy is extremely high, more than the required volume, and a woman who has a huge baby, a baby that is a large baby, that has extended the uterus so much that the capacity for the uterus to contract and cause hemostasis is inhibited. And many more, including uterine fibroid, and then a retention of, or what doctors call precipitate labor. Labor comes so fast and the baby is expelled. So generally, in summary, I would want to say that bleeding during pregnancy and after pregnancy is a major killer of our mothers. So we would want to encourage our mothers to attend the antenatal clinic so that anemia during pregnancy is discovered earlier, multiple pregnancy during is discovered earlier, polyhydramnios is discovered earlier, wrong placentation like placenta previa is discovered earlier, and if accident occurs and the placenta detaches, then it's quickly also attended to by doctors. So quickly, we want to encourage people to improve their health-seeking behavior so that we avert maternal loss. Thank you very much.
Assalamu alaikum wa rahmatullahi wa barakatuh. Makhanki wa naidani Aisha Hussein, Daktari Maamulki Wole Raguddo Hospital County Referral Hospital. Armo antanti jiratu muhim klinik gadufan. Klinik Wole intun dacht muhimidi siman. Klinik wani muhima wan saida irrahimu jirana. Klinik Wole wajji gara chkhab wajji hamilki gaduftikan muhimani si said. muhimtiin qara klinikan wajji fasti wolentun garaachi saani ilmaanki sattumamt kaysin jisad geet agisi klinikan gadhuftara fedan waqtan klinikan ayu akra fedan maro sadeed ra fedan ammo maamulkin keendiyen ka maro afurleyo dhaxan ingum namin dhaxin ergomt maro fasti at gadhuftu si jisadi klinikan gadhufti fedan waqtaat klinikan gadhuft fast baaritaanki saayida si tochan muhimadin baaritaanki kana yo la alla ilmaanki kun garaga sente jisad geet computer ler sikayan di kake baran khayas di kake oji baratan muhimadini amanta na ilmanti kesa tuma khaba akiduri sagalenya tulle irnyata di kake lenu jiguddo khab tandi bi baritanki doctora samena male baritanki nutrition edan nutrition ni baritanki sirato chanka jirka ki akti nafaqadi khabdu kan ilalan baritanki ndibi muhima ka waqtat fast clinic blow stopchani baritanki edani prevention of mother child HIV tan xudurki HIV AIDS kale sirra baran yo sirra targani waqta sun dawa lesikinu andahani muhima dawa kun ilma kelen kinga itita atilesi muhim mainan jirka ke kunini wan kanan shaqay muhimadi dibi sirra lalan infection syphilis leni said laf jirti yo sirra baran baada HIV sirra barani atinqabne syphilis sirra barani sirra dabani sulle muhim maina ilmaanki kuna kisin garaache ke jirto akisini akida saga jirat fedan tandi bini baritaanki dika ke akbarata nooci dika keedi baritaanki sulle muhim blood group na resa sedana faanki ka daktari ledi blood group ka yo baratani ilmaanki ke kana muhim nam guddinna garaachi marro agasi radi debiye jir sababtin suman resa sake imbaratan wolenten guddini resa sani positive echu resa sake kakira fedan wargari ka resa sani negative jir war negative kanam yo itargan barani targani agsi lilme to kenani fijir lilmen kun nafkaketif nafima ke suma waltakatoch akla alla yo diga ke ka ilmani walintane dawa su saide waltoche akil man ku siraga dimun tochan so dhiiga kee baaritaankiin sulee muhiim taan dhibii waqtiga kliinikinka dhuftu agatin guldeem kliinikun ilmaanka kee in laalan shanqarkiisaanii baratan atii caafimaadka kee sirraa laalan pressure sirraa cabiran iwoolenteen guddinii waqtaasaan kliinik dhufa waqtaan obahiyu kaji torbaji sadeedi waqtaasun pressure nasikahe fagoo mata sidhae weeste ilmaanka leeskisa ijeesu wandiid sulee waa muhiima ka warri keen ag baratu kliinik waqtaan rafedhan ag bilaawaniin taan dhibii kliinikana mudda kamuyyood dhuf daktariin kiiloo sirraa laal akkati way dartuu jirtuuf kaan kiiloon tulee muhiima innaan atillee lamaanta ilmaanchi kasa guddachuu jira agati way dartu agati nafaqadi duri waa nyaati yootin duri kijiko tok nyaata kijiko sattochiisu ma innaa ilmaan kulleen dheefee sirraa eegdi waan nafaqa isii nyaatti irra fedhan pressure kan marroo kamoo jettin kliinika dhuf sirraa cabiran cabirkiin pressure kun muhiim pressure kan khayyaas irra fedhanii jirka noomoledhan yoo khayyaas irra fedhan kaan kake ol jira qab daawa sii kenna daawaan kun maan pressure ke kan lafadhu wagisin ol kaatee sillee dhibaasi dhuftee ilmaan keellee dhibittiin geeb muhiimadiin dhibiin kliinika dhufaniif yoo atin la'alla jishan geet jishan wiiki digdama yoo ati gad dhuftee jishan geete waan kompiitar kaanii ilmaan kee kompiitar kaanii baratan jishanaan sun muhiimadiin kompiitar kaaniifi ag ilmaan kee yoo siin dhib qabd yoo ilmaan kee dhibi sii targan aksi keessa laalan yoo ilmaan dhib qabde yoo atin dhibi yoo itti qabde kompiitar sun tagarsiis sullee mapema tidaawii waan dahanii oo ilmaan kee la qarqaar waan daa taan dhibii muhiimadiin kliinika dhufaniif waqtii guddin kliinika dhufan warri keen wani kliinika dhufuufi ajali taalaali hulee muhiim taalaal tettena sedan muhiimadii taalaali kun hortagi suni siduratti ilmaa keellee wabaatii fi atillee wasiibaat warri kee yoo taalaal kennanii fi guyyaa fasti buugii deqeebiyan bes maroo dhibii deebi'anii maan faanin dhawatan waan irraa fedhanii kliinika marroo kamuu si kenna waqta sun agati gad dhuftee taalaal kee fedhattee baaritaan kisi sochanii pressure ke waqta amu si cabiranii khayyaas baratan taan dhibii khayyaas dhiiga ag gulaandeema waqta kamu dhiigi hum waqta kamu agta kaan ta'u guyyaa karaat kliinik biloo goyeze dhiiga kee point 15 agum garaachi kun guddatummaa ilmaan kulleen si keessa hooti nafaqa si keessa guurte gadi qaad so ojja kamu at kliinika dhufte ag dhiiga kee sirraa baarani khayyaas dhiiga kee di baratan lee muhiim sullee muhiim kliinika dhufaniif taan dhibii wolenteen yoo sila akida sa kliinik faan deemtee waqtaa rafeedhan dhaxtee akki rafeedhan dadaal isii hekeetu baaritaanki kanaaf waan cufra baaranii yoo isii dhibi targan abbaa ilmaan sulee qabanii waliin baaran sulee muhiim dhibi mambo nadaafadiilee saayid irra dubbatan health messages jenna nadaafadii waan dhuug irra deemti xaafimaad keena lekee jirti xaafimaadi kulee muhiim iwoole garaachi qabtan waan dhuugatti irraa yal jir waan immune dhanii jir immunity jedhan immunity'n tun waan jirka kee kan dhukub irra dhoortu hojjetiin garaachi qabdamma immunity teetilee saayii yala buuti waqtaas namsi nadaafadii ilaalite sagalee akka sirraa fedhan nyaate waqtaa atiin istaal baahantii dhufti irraa fedhan yoo ati namoo faanin dhoof kaati warkee teetee eegi guyyaa fasti wikii 12 buugii fudhatte bakka sagalee eegdu sulleen dhibisii qabdi so waan irraa fedhanii warkee nagiseen baratanii muhiim kliinik kana baaritaanki saayida kaan maakennanii jira kliinik eensi kullee waan dhuug dhibi qaba faayidaa dhuug dhibi qabata maama yoo baaranii dhibi targan warri isaanii familii isaanii bilee dhib kan irraa baaran sullee muhiimisii agnu faayyaan tulleen dasoomisii taan dhibii yoo nu akka dasa kliinikan faayyaanee qayaas pressure keena barannee pressure keena akka dasa kontroolanii qayaas dhiig jirki kee jirullee barannee guyyaa nu dhaluu jiraan waqti dhalmadii yoo singeet dhibi keenya diqqaat maa yennaani waqta sun nafee dhiig qayaasa qab dhiig furkii waan qacuf sirra fagoo jir sullee muhiimisii qabdi so waan kee warra mandheerahaanti waan isaanii yeenyu jiraan muhiim kliinikan afaan dhawa kliinikan agatiin bilooftee bakka miishoo waqta si kennan yoo isin saddeettaan obaafatu dassa baaritaanki kamulee haqiitti qabdi aksii baaran istaalii keen guddaan kun baaritaanki kliinikana buuree nama tochan wamma sirraan fuudhan kaadhiin dhamamaa jira nami shilingi si gaafatiin jirtu baaritaanki kun firii so agatiin dhuftee faan dhoof yoo dhaqaatiillee raafatte agatiin baaritaanki kanaaf kan naatocha jettu kompiitaalleen wiikee maroo lamsachan buure shaniitti kompiitaatee buure haala diilmaanii taasii rabbiin guddaa si keessattuu kan bara kan akka isiin jirtu waqtaan kaan dibilee akka ulageetu waqtaa akka ilmaa akka ulageetuun kompiita yesir kaayani akka ilmaan kun ciiftu akka ibidiin ciiftu abooyidiin ilmaanii ciiftu akka qayyaas isaa ilmaanii cufti muhiima akka baratan cufirraa faayideeffachuu handeeti haafimaadii muhiimedhaan waa'eedhaan haafimaadii muhiim عملي هورتاجين حاف ماذا كله مهم أجسني دالتن حاف مات كيسن شكرا. السلام عليكم ورحمة الله وبركاته. مغانكي فاطمة نور and Deputy Director Nursing Service ambulance referral اللي أنا تتجده وأنا رد بشوف هيدو ديجو وله بافت وجيسين كراش خبدو ديجي وله أكلمه بافشوا عندها تقرافي ديفو وله يو إسين جترب كراش زيد جترب جاي ka digi baafade digi suna kamin be ko jiratani digi sundu kubiyan qabdu akano mat mama ka wamuto kollen sindain ka madada wamut yani ajali yoten sayna akano ma digi si baafata sulle mahanisi avani war daktaritin antepartum hemorrhage danini antepartum hemorrhage akilama toki mahan previa banani akoti ga buqaye fula milman banam tunu jada la chufet kan ga tefata isin grades qabdi types qabdi 1 2 3 adani akisini types stala namdu fani types kan lalani en sungudini si wole osin ta sunitibute emergency yosin stala lufte kaisin fallen cages lalani ilman akon agam os cover yani os fulal man gabatun kan agam mitirjir manenan akisam beitan ifiyu mata ilmani isi ilman duraga dufte damale isi akon durtet qalada yo qaladi sumbuye ka waristala arge wani makan emergency wole akasi agsini tieta gesani rakhalan taati manenan digi zaid wole irba manena markamu ka wole folan sentu matan ilmani akutan ta fulal man sala banam tun kan tetu dufte matat akan te woni hantat yosi digi zaita sun makan si privedan taleni akoga buqat akoni usually wole osingraj qabdu akoni محلكي مامات تساقبدي أقونتان قبوقاته يوس المان عملي ماماني ديجي بافت so yo woleni garaj qabdu en garaj ka ke kaji torba baka disagali yo twana kasi uftagarte wonisu wan yani arakaraka ak emergency wole isira stala qabdan fedani waratin dowina yo garache ammo jitor birdaqa aboshorane sulle stala andu fani stala andu fu mala male warad wartani dadawla wabasan maqayno wabasan tani wole akisini itirawachu jitsuni mane nani en wole qara maanta waqti jankana lafti zaid abarti en dibzaida qaraw jafastu si qofateedu di kuday tokfan qaban namigari agra fedani wole agsin di kuday tok sin man garage approximately kuday tok rafedani egil man garasi sen atinam namdibin kanafte qabsik hejiru aga dadalate sagale nyate diga kesi kala chafedan yo ammo isi akasi qara wajja qarato yo diga kedqa dig furunki si bute wan emergency kastala reban namike ni gudina wole gudina akoti kayamani warati akonar bite baada mamayashin lubutat stalan gareban yo atga duftu wanatin egi kale waratarka qabdu masahato kasati stali qalat sunsaxun nandaw wole wan rafedani wan kamu ka darura yora targani agar kastalan gareban dig furankin wani 75% wole wani jesu jira gudina dig furanki en wani du funi dandaha dig furanki suni ak darurat wole duftun dig furankin dibin wole tubudan detu baada maman dalte kasafat كان رني كزمان immediately وله كان رفضان دهماني كإر جدنا وندفاني محلكي والتقون جورة جد محلكي وان فداني بعد الما كسبات أجسي والدبته أكو جفاست جراتين خمني كاني فلسون الدبت pre-gravid state دانين يو أمو محلكين فلسون الدبت الدي كيسين كانوا متهد كيسين فلسان تندبني يبو في قبض سنت سايد وين مادة ما دلتي كسباته ونزايد وله إجازة ديك زايدة سون كبابة تاندي بين أجا أكوسر رجباسن كأسات أبي سولين ديك فرانكي وولي تنفودان ديت تان أجا إلمان دل ترسا يوكان كسيكوتان يو فلان إلمان كزاكباس سافيكس دن سولي أفان سيسي كوتامته ديك زايدة باودان ديت تاندي بين وانسي كسات تفكا كنجرتي تناتي إن ديك زايدة تنفودان تاني دي أي سي داني ديك حنجرة فجودت دي كان كحنجرة فجودت دي كك عادي دم وني ديك حنجرة فجودت دالله وانو زايدة وجا قرات وجا ديك بعده بين clothing system كك كان كديك حنجرة فات اندقات so أكميني وات ما تدفون دندها PPH bendalt bafat kana maanta dhufuridan dahiran wani dhufuridan daha wolen gari ilmaalan fagara qabt ilma matanidi ilmaani mahalkin aada ojo en wani kun aanu rabbu ume kasitume ilmaalama ke jirios expandite zaid ballate yo ilma dalat kan arakka gadin debitu mahalkin kan gadin debi ake mama irati dhigi fakatuna kas tan debi bisaan ilmaan kee jira kan ka zaida yo bisaan kun qiyaas fidani ka qiyaasa jikara bin gudami dax yo isina mo qiyaas daftat mahalkin in ballat yo sin ballate gudata kani wajal mandalat kan gadebin dibtat tan dibin ilmaan gurgudo ma magari jirata ilmaan zaid kilo si zaida dalt yos akum ilmaan gudatu mahalkin gul ballat yos mahalkin fulahan gadin debitu en di furankina male bilawat tan dibin wolen gari فولنتينا مو أقربين قدان دفين نميغري حركة فولت دب بداني محل كين كاني يعني حركة المان دلان كاني سولين ديك فرانكين دفودان ديت ان تان دبيني ما ماشين تينيني المان زائدة أكان دلت جراند ملتي بارازن ما مانغري المان كده سدي كده فرصقل كاكنا دلت أكو ما دلتو محل كي كقول بلت قيات انت الدبرات قيات الماشن جالته ان محل كنا كتكانجور سو محل كن اكسباند سونني مركمو كادالتو ديبان سيدفودان دو السلام عليكم ورحمه الله
بسم الله السلام عليكم ورحمه الله وبركاته magacayga waa xareedsu xasan agaasimaha ku-xigeenka waaxda nafaqada iyo nafaqeynta ciyaalka iyo hooyooyinka wasaaradda caafimaadka u shaqeeya county government Mandera waxaan rabaa inaan dadweynaha ama bulshada la wadaago xaaladda nafaqada ama nafaq darrada ka jirto ma haysato caruurta iyo dhallaanka iyo hooyada haysato inaan la wadaago bulshada oo wacyigelin aan ku daro in yar wacyigelin aan raaciyo waxaa jirta saad la socotaanba abaaro ba'an oo ku dhuftay deegaanka aan joogno countiga Mandera iyo deegaamada waqooyi bari abaara iyo waxaa kaloo jira oo ku dhuftay dhulkan iyo adduunyada dhammaan waxaa kaloo ka jira cimilada isbedelka cimilada waxaa kaloo jira inay roob la'aan jirto roobkii oo soo daahay ama roobkii oo yaraaday ilaa iyo 4 roob oo soo dhaafay aad bay roobku u yaraayeen waxaa kaloo jira inay maaragtay cudurro sida cudurka COVID-19 uu jiray oo maaragtay dadka aad iyo dhaqaalihii hoos u dhigay iyo caafimaadka bulshada waxaa kaloo jira in maartay cunto yaraan jirto oo maartay cuntadii aad u yaraatay gabaabsi noqotay abaaraha darteed xoolihii oo maartay ayagana daciifeen oo maartay jirkoodii daciifay qaarkoodna xoolihii ay dadka qaar xoolaha ka dhamaadeen taasoo keentay in caano yaraan jirto caanihii yaraadeen ama caanihii la waayba oo caano jirin taas la adligeed waxaa korortay nafaqa darrada saameysay hooyada iyo dhallaanka khaasatan waxaan warbixinta kooban oo ku saabsan abaaraha waxaan ku haynaa ciyaal u dhaafa 100,000 oo canug ama da'doodu ay tahay 6 bilood ilaa 5 sano inta ka yar ay Mandera County ay hayso nafaqa darrada guud sidaas oo kaleeta hooyooyin gaaraya 15,000 ku dhawaad 15,000 oo hooyo oo ku uurka ama nuujinaya oo ayadana sidoo kaleeta nafaqa darra ay hayso ayaa laga yaan warbixinta lagu hayaa oo warbixinta ku saabsan abaaraha ay soo sii daysay taasoo cadeynaysa oo cadeynaysa sanad walba ama xilli ka dambeeya inay soo kordhayeen ama sare u kacaysay hooyooyinka nafaqa darrada haysa iyo ciyaalka ama dhallaanka yaryarka oo da'doodu ay tahay 6 bilood ilaa 5 sano waxaa sababay arrimaha aan horaan soo xusay iyo waxaa kaloo jira inay maaragtay cunno yari jirto oo khaasatan xagga hooyada uurka leh ama hooyada nuujinaysa waxaa la rabaa markay uur leedahay u yaraan ama hooyada nuujinaysa waxaa la rabaa inay 10 nooc cuntada ka mid ah inay cunto ama ay qaadato maalin kasta laakiin u yaraan haddii 10 ka wada heli karin inay 5 noocaas cuntooyinka ay ka cunto sida khaasatan sida cuntada waxay u kala baxdaa noocyo badan sida qaybta badarka ama badarka waxa galeyda bariiska burka baastada ku diwa badar ama cereals ama daqiiqa waxaa kaloo jira nooca proteinka laga helo sida ukunta hilibka waxaa kaloo jira nooca cagaarka oo fitamiinada iyo laga hela macdanta noocyadii oo dhan baa maaragtay aad u yaraaday hooyada ka uurka leh ama tan nuujinaysa waxa la rabaa u yaraan inay markay uurka leedahay intaasoo aan soo sheegay inay 5 nooc oo cuntadaas ka cunto maalin kasta u yaraan haddii ay wada heli kartana 10 kaba cunto waa muhiim taas la adligeed waxaa dhacday marka inay dadkii tiyo heli karin haddii tii la heli karin waxaa jirta in maamada markay uurka tahay istaalada tagto oo istaalada laga siiyo kaniinka maaragtay loo yaqaan kaniinka kordhiya dhiigo ama tamarta hooyada kordhinaya inay la xiriiraan oo goobaha isbitaalada laga bixiyo badi waxaa jirta markii dhiiga kaniinka dhiiga hooyooyinka lasoo siiyo ama kaniinka tamarta kordhinaya badi waxay sameeyaan inaysan kaniinkii ama daawadii sidii loogu talagalay ay u laqin ay iska tuuraan aysan cunin kaniinkaasoo ognahay in cunuga uurka ku jiro iyo hooyadaba wax weyn u tari lahaa xagga dhiig iyo xagga tabarta hooyada uurka leh taas waxay keenaysaa badi markay hooyooyinka ay xilliga dhalmada gaaraan hooyada inay dhiig la'aan noqoto hooyooyinka badi markii la dhahaa cunto fiican qaata ama maaragtay cunto fiican cuna xilliga uurka ay leeyihiin ama xilliga ay ilmaha nuujinayeen waxaa dhacda badi inay ka walwal qabaan ama ka cabsi qabaan in ay maaragtay cunugii caloosha ku weynaada ama way dhahda cunuga ay ugu weynaana cunuga haddii weynaadana ay ka cabsanaysaa cabsi ay ka qabtay in la qalo markay dhalayso so waxaa dhacaysa taas fikrad sax ma aha ayna sax u ahayn dhibaatooyinka ka imaanaya markaysan cuntada cunin ayaa ka badan dhibaatooyinka hadda ay ka cabsanayso ay leedahay cunuga weynaanaya sababtay tahay markii oo ay cunuga uu jiro caloosh ku jiro uu yar yahay ama kiiliisa yar yahay uu 2 kiilo bar ka yar yahay uu noqdo waxaa dhacaysa ama hooyada dhiig la'aan bay noqonaysaa cuntada cunin ama waxay noqonaysaa cunugii dhalaysaa wuxuu ka yar yahay 2 kiilo bar ama waxay noqonaysaa cunugiiba wuxuu ku dhalanayaa xanuuno sida maartay burooyinka ilmaha ay ku dhashaan ama faruurka cudurrada loo yaqaan taas isku geen dhamaantood waxay keenaysaa ilmihii iyo hooyadiiba inay maartay dhibaatooyin weyn ka soo gaarta cuntadii ay iska yareynayso markay uurka ama cuntooyinka aysan qaadanin oo la rabo inay qaadato taasa waxaan ka wacyigelinayaa bulshada ama u sheegi lahaa inay hooyo kasta uur ah ku dadaasho inay qaadato cuntooyinka muhiimka u caafimaadkeeda iyo cunuga caloosha ku jiro sidoo kale midda nuujinaysan waa mid la mid ah saas laga rabaa iyadana inay cuntooyinka caafimaadka hooyada iyo tan cunugan ay nuujinayso muhiim ku ah inay qaadato waxaan marka taad la adligeed waxaa dhacday inay maaragtay haddii hooyinka cunuga cuntadii ay heli karin abaarihii dhibaatooyinka jirin aan soo sheegay ay dadkii saameeyeen cuntadii ay yaraatay caano jirin dhaqaalihii hoos u dhacay waxaa dhacday marka nafaqa darrada inay soo kordhaysay sanadka ka dambeeyay hadda waxaan ku haynaa saan idin sheegay horaan 15,000 in kor u dhaafaysa oo hooyo oo ku nuujina inay nafaqa darra hayso countiga Mandera sidoo kale ilma daadooda u dhaxaysa 6 bilood ilaa 5 sano oo 100,000 kor u dhaafay in ayagana si la mid ah nafaqa darrada ay hayso waxaa kaloo jira marka dawladda maxay tilaabo qaaday ama ay qabanaysaa dawladda countiga Mandera iyadoo la kaashanaysa hay'adaha maxalliga iyo kuwa caalamigaba waxay isku dayaysaa inay barnaamijyo fuliso lagu hortagi kara arrimaha hadda aan soo sheegay oo nafaqa darrada hooyada uurka leh iyo ilmaha yarka waxaa ka mid ah barnaamijyadaas inay maartay goobo caafimaad oo ay gaarsiisay meelaha tuulooyinka fogfog oo la gaari karin oo loo yaqaan outreach maanaha tuulooyinka ka fog meelaha isbitaalada waxaa lagu sameeyaa ama la geeyaa isbitaal daawo ama caafimaadka asaasiga in la geeyo 272 meel goobood ama tuulooyin ama maaragtay settlement ama deegaanmo oon lahayn isbitaallo in la gaaro ee countiga sameysay oo maaragtay lagu daaweeyo ilmaha nafaqa darrada haysa iyo hooyada uurka khaasatan gaar ahaan lagu sii daaweeyo waxaa kaloo dawladda ay tilaabo qaaday ama maaragtay countiga khaasatan wasaaradda caafimaadka ay sameynaysaa inay isbitaallo horaan jiifka oo ilmaha lagu xanaaneeyo 3 isbitaal oo ku soo kordhisay 7 hore sii jiray 3 isbitaal waxaa ka mid ah isbitaalka Aymole isbitaalka Liweheri Dandu waxaa laga furay goobo ilmaha nafaqa darrada oo xanuunka u helisay lagu daaweeyo 5 sano iyo 5 sano ka yar 6 biloodna ka weyn oo nafaqa darrada haysa 94 isbitaal in la keena quudintii ama nafaqadii ama daaweyntii ilmaha lagu quudin lahaa oo iyadoo la kaashanaysa hay'adaha gacan ka siinaya arrinta ayada dawladda county government Mandera waxaa kaloo jira inay dawladdu furtay meelo 4 goobood 4 isbitaal laga furay goobo oo kayd loo dhiga nafaqada kayd ah saddexda afarta gooboodna oo mid goob waxay ku taallaa Raamo isbitaalka Raamo goobna waxay ku taallaa isbitaalka Banisa goobna isbitaalka Elwaq afar goobaha ayaga waxaa raashinkii ama wixii lagu daaweynaa taasna waxaa loogu talagalay meeshii Allah goobahaas waxaa loo sameeyay meel Allah ama isbitaalkii county ka mid ah oo ka go'a raashinka ama daawadaas ilmaha lagu xanaaneeyo hooyada inay si degdeg ah loola gaari karo